Welcome back to Cosmetic Art. Do you want to look 10 years younger, but you don't want to go under the knife? Anti-aging physician Dr. Amir Rouzati of Rejuva MD Anti-Aging Clinic says he knows how. Welcome to the show.
Hi, Rita. Glad to be here.
Tell me a little bit about your anti-aging clinic.
Sure. So, anti-aging basically involves using non-invasive methods to accomplish rejuvenation. This often involves treatments like Botox. We've all heard about Botox, used to soften lines and wrinkles in the forehead and around the eyes. Things like Juvederm, used to replace lost volume in the cheeks or in the nasolabial areas or in the chin. And at times, procedures involving lasers and other modalities to improve and rejuvenate the skin.
So what exactly is Botox?
That's a good question. So Botox is a protein, and the function of this protein is to soften and relax exaggerated muscle activity. So one type of aging that occurs is aging related to exaggerated expression. People that frown all the time, or maybe in speaking, they move their forehead up and down. So you can inject these areas, these muscles really, with Botox, and the end result will be that the movements will be softer, and hence the lines that were there will diminish, or better yet, even prevent furthering of those lines.
That's right. And I just wanted to ask you, are the effects permanent?
The effects are not permanent.
Okay.
Generally, a client would do a treatment like this 2 to 3 times a year. But of course, we have all types of clients. Some people come in just before a wedding or some big function they want to look rejuvenated for. But in reality, once they try it the first time, the satisfaction rate is quite high, and they generally budget time and money to kind of maintain the results.
That is so good to know. And is there an age range?
The age range more and more becomes younger and younger as we see a lot of clients come in for that preventative effect. But we certainly see a lot of women in their 30s, 40s, 50s, that's for sure.
Okay, so what I wanted to ask you as well is, what is the difference between Botox and Juvederm?
Yeah, so that's also a good question. So again, Botox is used generally from the nose up. So it's used in areas around the forehead or the eyes where you have this exaggerated muscle activity causing these expression lines. Whereas Juvederm is made up of hyaluronic acid, a type of sugar molecule, and it's used to improve or revolumize areas of the skin which lose volume with aging. So, as we age, we can lose some collagen and volume in the cheeks. You can get kind of hollowed eyes. You can get deep nasolabial lines or some shallowness in the chin. So Juvederm would be used to revolumize that. Botox is used to soften expression lines.
Wow, that is excellent to know. So with us here today, you have a beautiful model to show us what you have done on her. Arletta is here.
Right. So, today we have two models, and each of them represents 2 different types of categories. So the first time that I saw Arletta in the clinic, she presented at a time where the lines, the expression lines had quite set in, as you see in the before picture. So she had some prominence in her frown lines, some forehead expression lines, and some descent of the eyebrow. But when I saw her in the clinic, she had a very youthful persona about her, full of energy, and I know that she leads a very busy lifestyle. So we just wanted to make sure that we can rejuvenate the forehead to allow it to match more her persona, and that's what we did. So this is one type of client. They present at a slightly later time where the lines have set in, and you can get a result that is subtle but still has a bit of a wow factor to it.
Wow, she looks absolutely beautiful. And with us as well today, you have another model.
Right. So next, we're gonna get a chance to take a look at Lucy, and Lucy is more that second category of clients that we see more and more of. Clients that come in from a preventative focus. So when I saw Lucy in the clinic a few years ago, she didn't have many lines to speak of, but she was aware of the fact that she's Italian. Italians like to express a lot with their forehead, and she wanted to make sure that that expression doesn't result in exaggerated lines. So she came in more focused on prevention, and in the consultation we can see what type of facial mimicry does she have, or is she prone to having, and soften those areas with the use of Botox.
Okay, and how young can you go? What do you suggest?
You know, generally we see clients all in their, we see a lot of clients in their 20s. I don't like to treat anyone much younger than that. An interesting trend that we see a lot these days is actually moms bringing in their daughters. So you'll have a mom who will be in her 50s or 60s. They would have done some Botox and had good results. And moms always want the best for their daughters.
Right.
So then they'll bring in their daughter, maybe age 20-something, 30-something, and again, taking that preventative approach, because perhaps the daughter also has a similar facial expression to the mom. So that's a trend that we see a lot of.
That is unbelievable, Dr. Rouzati. So one last thing that I wanted to ask you is, what is affordability? What's the price range?
So, you know, these type of treatments can range anywhere from $350 to $1,000. But what we find is that more and more these treatments are very much mainstream. So all different types of clients come, you know, women that work, women that stay at home, many different types of backgrounds, and they see good value in it. So one thing I encourage clients to take a look at is comparing the cost to how long the treatment lasts. So really, if you do end up doing a Botox treatment a couple of times a year, and you average that cost over the course of the year, it's probably costing you maybe $2 to $3 a day.
Right. Absolutely. So what are the benefits of not going under the knife?
You know, when I speak with plastic surgeons who've been in the industry for a long time, they really appreciate how much can be done in a non-invasive manner. So, you know, we tend to take these types of things for granted now. Oh, you know, I went to my lunch hour, did some Botox, and had a nice brow lift or softened the foreheads. But the benefit is really that you're not taking any of the risks of surgery. You're certainly not taking the expense, and you're not taking the downtime. Most of us have very busy lifestyles, and we don't want to take a week or two to recover from a surgery.
And how can we get a hold of you?
You can contact us through the website, and we'd be happy to see you for a thorough consultation.
Great. Thank you for joining us today. Coming up, get fuller, thicker, sexy eyelashes with Eyelash Me.